Here we are again as we continue the discussion on women's reproductive health. Tonight topic we are going to look on polycystic ovarian syndrome, a term that is getting more popular among us as females. We have our doctor again back with us today to discuss more about polycystic ovarian syndrome. If you want to hear more, stick around. Yeah, so tell us what is PCOS?
So PCOS, as it's commonly known, or polycystic ovarian syndrome, is a syndrome that affects our female population. It's more than just the ovaries having a lot of cysts, as the name might suggest. But what it really includes is many symptoms that affects just about everything. So the menstrual cycle, her skin, and importantly, fertility. And these symptoms combine with what is found on the ultrasound, which is where the name comes from. The polycystic ovarian syndrome occurs because the hormones are not balanced or imbalanced, as a lot of people would say. So it's a hormonal disorder with multiple symptoms.
Okay, because you mentioned about skin. So like, for example, what are some of the things that you see happening to the skin?
Yeah, so one of the big things with the hormonal imbalance is this hormone called androgen, which is an hormone which is seen in both male and female, but more so in males. In females with PCOS, they tend to have a little more androgen than the regular female, so they tend to find that the skin is quite oily, or can be quite oily, as well as have a little more hair than is expected, and what we describe it as male pattern hair. So just about anywhere. So the chin, mustache, the chest.
What are the doctor? Sometimes I find myself. Sometimes I find myself I pick out 1 and 2 ear, in the chin.
Yeah, it's not.
What are you trying to say? It may be a hormonal thing going on.
Definitely.
Okay.
Definitely. Yes, you have some ethnic groups, like our Indian females. They might, they're known to be hairy, so okay. They might have a little challenge there with those patients. But for the rest of the population, where they're not known to have those male type hair formation. And so some, in addition to being hairy, as some people describe it, some people, like the back of the neck, can become velvety and dark, and this is because of we call insulin insensitivity. So that's a term. It just pretty much means that the body is not metabolizing glucose as it's supposed to, and it's a marker for persons who are at increased risk for diabetes.
Okay. So what I'm getting from about the whole diagnosis, the only way you'll be able to really diagnose a female for PCOS is through an ultrasound.
No.
Okay. What are the different
ultrasound? The main thing that ultrasound tells you is about ovaries having a lot of cysts.
Okay.
And that name comes from, but that's the least of the criteria to make the diagnosis, because you can't have a female who is completely normal cycle, don't have any problem getting pregnant, normal female hair distribution, and when you do the ultrasound, she has many cysts on her ovaries. It doesn't mean that she has polycystic ovarian syndrome. She might have polycystic ovaries, but not polycystic ovarian syndrome.
Oh, so there's a difference.
There's a difference.
Right?
When the syndrome comes in, you'll have these persons having the menstrual problems, so they miss their periods for months upon months, or for some people years. they tend to when they have the cycle, or if they have the cycle, they don't ovulate, and because they don't ovulate, then they're gonna have trouble getting pregnant. And what you find a lot of persons find out about them having polycystic ovarian syndrome when they have difficulties getting pregnant, because that's when they go to seek medical care. Just as you said, you're picking out a 1 or 2 ear every now and again. Now you say, okay, let's pick out ear because you don't like to see, and you're not really taking anything, you're not thinking anything about it. But when you have a problem getting pregnant now, you're gonna rush to the doctor because something wrong. A lot of people find out about the diagnosis that way.
Okay. All right. So is this thing hereditary?
Yes. So we find that it's common. It's commonly found in close relatives. So, for instance, if you're so first degree relative, so if your mother or your sister has PCOS, chances are you have PCOS as well. So we know for sure there's a genetic component to the disease. However, they're still unable to say exactly what the cause is, but there's definitely some genetic predisposition.
Okay. So then what are the treatment plans? Because I'm hearing a lot about hormonal imbalance and everything like that. So what are the different treatment plans or treatment options that are available for females with PCOS?
So the treatment options pretty much includes, symptoms. So you can start with those. So, what sort of symptoms is this patient having? Is she having, issues with acne, issues with hair under the chin? And so, of course, you'll apply treatment accordingly. So, of course, the dermatological agents that will help with both treating acne and hair. When you start talking about things such as problem with fertility or problem with the menstrual cycle, because to them missing periods. For some patients, when they do start having the periods, it's usually heavy and prolonged. And so for those patients, they might need to incorporate medications such as hormonal medications that will try to help put things in a more balanced state. And so commonly people refer to it as contraception or birth control medication. So for some patients, we'll give them those medications because it not only helps their cycle, but it also helps things like their acne and the hair growth. And so those, so the hormonals will cover a wide range of issues. Also, we spoke about patients who are at risk for diabetes because of PCOS. So one of our treatment is to put patients on medication that will help the insensitivity. And so medications like metformin. You say, boy, but my grandmother take metformin, but yes, we find that it helps people who are PCOS because it helps them to lose weight, and it also helps to regularize their sex so that they can actually ovulate, and so it increases their chance of getting pregnant when they're ready to get pregnant. So those are some of the things, and lifestyle is a big. I should have mentioned that first. But lifestyle is
yes, because that's the thing that I'm about to go into, like the change in your lifestyle.
Lifestyle is a big thing, and a lot of times there's treatment failure because the patient still is unable to still unable to modify how they eat or they exercise, and so the medications alone work. So of course you say weight loss and dieting, but what does that mean? It's difficult for the patient or anybody for that matter to conceptualize. And so for those patients who you think that just a regular advice is not going to work, you can incorporate the dietitian to help you with that. But certainly just in your meal, the food that are sweet stuff, the high carb diets, those are notorious for
the Jamaican cuisine it is highly high carb. So when you're gonna say no, it's like you're telling the patients don't eat no food because we're talking about our rice and peas, we're
Right.
talking about our dumpling, yam, banana, chocho, all of them something there.
The ground provision is good enough because those are complex.
Well,
Complex.
yes,
So,
those will break down a little bit. But then
right,
you're talking,
the sugar level that quickly.
yeah.
So we're good.
But boy, them things now so rough in a Jamaica. Like,
I mean, what I advise my patients simply, I tell them, I try to be, try to make it simple for them. I tell them, I mean, if you're unable to adjust it, that significantly, start by cutting down the quantity. So if you normally eat 4 dumpling and 2 banana, you cut it down to 2 or 1, right? If you normally eat a big box food for lunch, go to a small one, right? Until things can change. And then, of course, the juice and those things. If you can get rid of juice out of your diet completely, that's a big thing. And then, of course, I mean, that's money. You're saving money there.
that's true.
Replace juice with water.
Unfortunately, my dad and some members of on my father's side died from diabetes. So I am now pre-diabetic and I have to be watching, all of the things that I'm consuming. But I realize that in Jamaica, it is harder to kind of control that aspect of it, especially when you're cooking for an entire household who is not diabetic. Like it's not easy. And to buy a piece of broccoli, because I have introduced like my mom to juicing.
Right.
That and one piece of broccoli where she tell me say one piece of broccoli for $500 and something dollars.
It's not cheap. It's not cheap.
It's not. It is not. But one of the things that I use to console myself is it is much cheaper to live healthier than to live unhealthy, because you're going to spend that money in medication, you're going to spend that money in surgery and all of that.
Yeah, the repercussions are rather difficult, both emotionally, physically, and, as you said, financially.
Yeah. How can the family member or spouse help to assist a female who is living with PCOS? Because this is not something that, is this something that she can get rid of totally, or she just has to continue on a regimen or treatment plan for the rest of her life?
Right. So, I mean, not just, so the idea is not to keep them on whichever medication it is that you have started them on. So the idea is to get them to adjust their lifestyle at a level that that would be supportive of the change that is occurring in their body. And so a lot of time, especially where we're getting pregnant is a concern. I mean, these are not medication that you're going to live on. So medication that you'll take, to improve your fertility, and then hopefully successful. So the big thing, and that's what I push, is lifestyle modification, because that is what you live with. That lifestyle change, you'll continue, not just to look good to go into some clothes, just because that will become a part.
Yeah.
Fertility part is a big thing for a lot of people. They're more concerned about that than anything else.
Yeah.
And so, as I said to you before, you can only get pregnant if you're ovulating, and if you're not ovulating, then that's a problem. Right. In addition to giving medication to ovulate, the changes such as weight loss, your exercise, your diet, those also help to improve your overall health and hormone profile. That will help. A lot of time, patients will realize that they're trying to get pregnant forever, and then the minute they lose some weight, it just happened, and they tell you that the doctor told them that they can't get pregnant, and it just happened without them even trying. So I mean, yes, it can happen. And if it doesn't happen, then there are medications and different things can be done to make it possible.
Yeah. So it's really not the end of the world.
It's not.
It's
It's
really
not.
not. And
It's
then
not
the God
what it
that we
takes.
serve, we know that there is nothing that is impossible when it comes down to Him.
Definitely.
Mm-hmm.
So I mean, it's a prayer changes things,
It does.
but definitely work is needed to be done.
Yeah.
Yeah,
Mm-hmm.
need to be done.
Wasn't that an interesting session? I learned a lot, and I hope you learned a lot as well. Thank you so much for subscribing, liking, and commenting below. Go on over to Amazon and purchase my book, How Not Knowing Costs Me Reproductive Health Issues. If you are serious about your reproductive health, contact Dr. Clayton Kelly at claytonrichardkelly@hotmail.com. 876-829-6041. Remember, your reproductive health is important.